Today, I'm going to talk about MRI of the neonatal brain. This is going to be the first of several sessions, and today I'm going to talk about the normal neonatal brain. And why is this an important topic? Because the brains of a newborn child look completely different from those of adult patients. Neonatal brains or neonatal MRI is not performed that much. So a lot of radiologists do not have a lot of exposure to these kind of MRIs. And they are only performed when the pediatrician or the obstetrician expects there to be something wrong in this newborn child. The patient might have a hypoxic ischemic encephalopathy, or there is suspicion of congenital cytomegalovirus infection, and so on and so on. And to be able to recognize these entities, you have to be able to know what a normal neonatal brain looks like. And that is what I'm going to teach you in this session first. What does a normal neonatal brain looks like? Because it looks totally different, as said, from that of an adult brain. These are T1 weighted images of a neonatal brain, a newborn child, a term child born at 38 weeks. And this is a T1 inversion recovery weighted image, but a T1 weighted image nonetheless. And this is a T1 weighted image of an adult patient. The first thing that is clear immediately is that there is a huge difference between the signal of the deep white matter. The deep white matter in an adult patient is diffusely hyperintense on T1 weighted images, while it is hypointense on T1 weighted images in a newborn. How come? How to explain this difference? The reason is myelination. In an adult brain, white matter is completely myelinated. Myelin contains a lot of fat, and fat is hyperintense on T1 weighted images. In a newborn child, the brain is, for the most part, not myelinated yet, so it contains a lot of water and not so much myelinated white matter, which gives the brain, or at least the white matter of the brain, a hypointense appearance on T1 weighted images. And the same reasoning applies to T2 weighted images. Here we see the T2 weighted images in a newborn child compared to T2 weighted images in an adult patient. In an adult patient, white matter is hypointense or dark. In a newborn child, white matter is hyperintense because white matter is not myelinated yet, and as a consequence, this brain is, how to say it, rather wet. It doesn't contain a lot of myelinated white matter, and there's still a lot of room for water molecules in the brain. The brain contains a lot of water, the brain parenchyma, giving it a hyperintense appearance on T2 weighted images. Now, over the course of about 2 years, this brain will myelinate, and as a consequence, the signal intensity of the white matter will change, and it will gradually become more and more hyperintense on T1 weighted images over the course of 1 to 2 years. And if we compare these images from a newborn child to a child of about, I think 4 or 5 months old, 8 months old, and here somewhere between 1 and 2 years, we see that the signal intensity has changed dramatically from barely any myelination in a newborn child to complete myelination in a child between 1 and 2 years of age on T1. So, over the first 2 years of life, white matter gradually becomes more and more hyperintense or white on T1 weighted images. And the inverse we see on T2 weighted images. We start with the T2 weighted images in a newborn child, and white matter is hyperintense and gradually becomes more and more dark or more and more hypointense over the course of 1 to 2 years until we end up with a brain that looks, when it comes to the signal of white matter, almost indistinguishable of that of an adult patient. So to summarize, during the first 2 years of life, white matter gradually becomes more and more dark or more and more hypointense on T2 weighted images. Let's summarize once again, and now compare T2 weighted images with T1 weighted images. a newborn child, a child of maybe 4 months old, about 8 months old, and somewhere between 1 and 2 years of age, and I believe closer to 2 years than to 1 years of age. T2 signal decreases and T1 signal increases. So how does this process of myelination occur? This is not random. It is a structured process which has certain tendencies. Let's start with what myelination looks like in a term child, newborn, shortly after birth. In a newborn child, a term child, we only see myelination in a couple of brain structures or a couple of regions. In the brainstem, in the posterior limb of the internal capsule, and in the deep white matter along the course of the corticospinal tract. Let's examine these structures on images. Let's start with the brainstem. This is an inversion recovery T1 weighted image of a newborn child, and we see that there is already basically complete myelination on T1 and T2 weighted images in the medulla oblongata, which makes sense because without a functioning medulla oblongata, we cannot survive. It contains a lot of areas that are crucial for survival. A bit higher up, at the level of the pons, we only see myelination dorsally in the pons, in the tegmentum of the pons, and there's also some myelination here in the superior cerebellar peduncles. And if we go still a bit higher up, we see some patchy signal increase and signal decrease on T2, signal increase on T1, and the mesencephalon, more specifically here centrally, and here peripherally at the level of the tectal plate, and this is the level of the decussation of the white matter tracts that run towards the superior cerebellar peduncles. It is not that important. What is important is that you can see in a term child shortly after birth signs of myelination in the medulla oblongata, centrally and peripherally in the mesencephalon, and dorsally in the pontine tegmentum, although I admit on this sagittal image, you don't really see it as well as you see here on this actual T1 weighted image. This was a T1 weighted image, by the way. Let's examine myelination a bit higher up. We are now examining the level of the deep nuclei. Here we have the basal ganglia. Here we have the thalamus. This is a T1 weighted image, and this is a T2 weighted image. Let's zoom in a little bit at the level of the basal ganglia. And what do we see? I have already encircled it here. We see an area that is hyperintense on T1 weighted images and hyperintense on T2 weighted images. These are the ventrolateral nuclei of the thalami. And you will always see some signs of myelination here in a child at birth. You can also see that in a preterm child. What is more important in a term child is that you were able to see this small dot or stripe here. It is hypointense on T2 weighted images and hyperintense on T1 weighted images. What is that? That is the posterior limb of the internal capsule, and we always want to see some signs of myelination in the posterior limb of the internal capsule in a term newborn child. If you do not believe me, let's compare it with the images of a preterm child born at 34 weeks. These are T2 weighted images, and this is a T1 weighted image. We see some patchy areas of decreased signal on T2 weighted images and increased signal on T1 weighted images in the ventrolateral thalamus on both sides, but, oh, and I zoomed them in, but we do not see the posterior limb of the internal capsule. Let's zoom in a little bit and compare this preterm child with a term child. In both children, we see increased signal on T1 weighted images in the ventrolateral thalamus on both sides. In the term child, we can see the posterior limb of the internal capsule, but the posterior limb of the internal capsule is completely absent on these T1 weighted images in a preterm child. And this is a normal finding in a preterm child. We expect to see this starting at about 37 weeks, gestational age. So when a child is born at 34 weeks and receives an MRI shortly afterwards, it is normal not to see it. This would be abnormal if we see it in a term child born at like 38 or 39 weeks of age. Let's examine the brains of the newborn child. This newborn child, still a bit higher up, here we see mostly unmyelinated white matter, except for this region. Here we see some patchy signal increase on T1 weighted images and signal decrease on T2 weighted images. What is this? What are we looking at? This is the corticospinal tract, which runs from the precentral gyrus, which contains the primary motor cortex, to the posterior limb of the internal capsule. And we can also appreciate the myelination of the corticospinal tract on these T1 weighted images, and we see the myelination or the corticospinal tract running from the precentral region towards the posterior limb of the internal capsule. It is not abnormal, it is normal to see some myelination here because newborn children, despite the fact that their motoric abilities are not the same as those of full-grown adults, self-evidently, they are able to move a bit. And as myelination continues and the brain further develops and matures, their motoric skills will also develop further. How does myelination occur exactly? There are some tendencies that were first described by Barkovich, and it is important to keep those in mind because you will always encounter those. So how does myelination occur? It occurs during the first 2 years of life, most of it, and it goes from bottom to top, from back to front, and from the center of the brain to the periphery of the brain. Practically, what does this mean? That it goes from bottom to top, back to front, and center to periphery? It means that you will see myelination in the lower structures of the brainstem and the cerebellum before you will see it in the cerebrum. It means that you will see it in the central parts of the brain, the basal ganglia and thalamus region, before you will see it in the deep white matter. It means that you will see it in the posterior limb of the internal capsule before you will see it in the anterior limb. It means you will see it in the back of the corpus callosum, the splenium, before you will see it in the knee or the genu of the corpus callosum. And it means that you will see it in the center, the central white matter, before you will see it in the subcortical white matter. Let's show you some examples. This is a newborn child. This is a child of 3 to 4 months old, and this is a 6 to 7 month old child. All children were born at term, so they are term children, and these are T1 weighted inversion recovery images. In the newborn child, we only see some myelination, as to be expected, in the posterior limb of the internal capsule. If we compare that with a child that is 3 to 4 months old, we see that there is a lot more myelination. And where do we see myelination? Well, we see some new myelination here in the deep white matter or the periventricular white matter of the optic radiation. The optic radiation is the white matter tract connecting the thalamus with the occipital cortex, and it is kind of normal that this white matter tract is one of the first white matter tracts to myelinate because vision is one of the first skills that mature and develop in a developing child. So we also see, if we look very carefully, some deeper white matter changes or myelination already here, but we can see none in the frontal lobes. We also see some myelination in the splenium of the corpus callosum, but compare it to the signal of the genu, here there is no myelination yet. We also see that myelination has extended from the posterior limb of the internal capsule to the anterior limb. When we compare these images with a child of 6 to 7 months old, we already saw some myelination in the splenium, but now there is also myelination in the genu of the corpus callosum. So myelination has clearly progressed from the back to the front of the brain. In this child, we saw some myelination of the central white matter of the optic radiation, but we see that this myelination has extended further towards the periphery of the occipital lobe, and we see arborization, a branch-like pattern of myelination extending all the way to the subcortical white matter of the occipital lobe. Compare that with the frontal lobe and notice that there is no myelination or barely any myelination yet to be seen in the frontal lobe. Just give it some time. If we would do another MRI in 5 months or so, we would see that myelination will have progressed from the back to the front and will also include the frontal lobe. We already had myelination in the anterior and posterior limb of the internal capsule, but notice that myelination has also progressed more peripherally and now includes the external capsule as well. So this image clearly showed progression of myelination from the back of the brain to the front of the brain, and from the periphery of the brain, or the central part of the brain rather, to the periphery of the brain, which can be appreciated both at the level of the deep nuclei and here in the occipital lobe. So let's now compare T2 with T1 weighted images. If we were to give an appreciation of the degree of myelination in this child on T2 weighted images, we would say that myelination is rather limited. We clearly see myelination here in the posterior lip of the internal capsule. And well, there are some signal changes here, but definitely not as black as seen here in the posterior lip in the anterior limb of the internal capsule. And maybe that's about it, yeah? We also see some decreased signal here in the optic radiation, and that's about it, I would say. And then let's look at the T1 weighted images, and even without examining in detail what is myelinated and what not, visually and at a glance, we clearly see a difference. We would estimate this brain to be more myelinated compared to the brain on the T2 weighted images, but it's the same brain. It's the same degree of myelination. So how is this possible? Why does myelination looks a lot less extensive on T2 weighted images compared to T1 weighted images? And if you do not believe me that that is the case, let's then examine another patient. Let's first look at the T2 weighted images. There is more myelination compared to the previous patient, right? We see clear myelination in the posterior and anterior limb of the internal capsule. We see myelination in the splenium and also in the genu of the corpus callosum. And there is a difference in the signal intensity between the deep white matter and subcortical white matter of the occipital compared to the frontal lobe. But this looks a lot more extensive if we examine myelination on the T1 weighted images compared to the T2 weighted images. We already saw some signal change, but it looks more pronounced and more extensive on T1 and the occipital lobes, extending also here and some gyri of the parieto-temporal transition area, and even some increased signal already starting in the deep white matter of the frontal lobes. So once again, we see a difference between T2 and T1 weighted images, with T2 weighted images lagging behind on T1. How to explain this? Because it's the same degree of myelination. The reason is that we are looking at the same degree of myelination, but T1 and T2 weighted images show two different aspects of myelination. What do they show us? Well, myelination starts with the development of a myelin sheet, and that is something we can pick up with T1 weighted images, because myelin contains a lot of fat, is fatty tissue, and will be hyperintense on T1. However, this myelin sheet, when it gets first developed, is still rather thin, rudimentary, and needs to be organized further. That is something, the organization of the myelin sheet is something we can see on T2 weighted images. So in a first stage, we get development of a myelin sheet. In a second stage, we get continuing organization and expansion of this myelin sheet. As the myelin sheet gets more and more organized and white matter increases, there is less room for interstitial water in the brain. The water content of the brain will decrease because there is more development and more organization of the white matter. And as there is less interstitial fluid in the brain parenchyma, the T2 signal will decrease. And this is something that happens in a later stage. First, we get a development of a myelin sheet with a resulting T1 signal increase, and only then do we get more and more organization of this myelin sheet, resulting in less interstitial fluid and a decrease in the T2 signal of the brain. I do not know, and I made a spelling error. I saw, my apologies. I do not know myelin milestones by head. I know the tendencies. I know that it goes from bottom to top, from back to front, from the central part of the brain to the periphery of the brain. But there are some nice articles out there that summarize them and give you some easy to use schemes and diagrams to estimate if what you see on MRI images is normal for the age of the patient or not. I can especially recommend this article here by Stout and Groth. It's a German article called Die normale Myelinisierung des kindlichen Gehirns in der MRT, but let that not scare you away. Look it up. Even if you don't know German, these are very nice drawings and very nice schemes to have lying next to you when you examine neonatal brain MRIs. Also notice that when we examine these myelin milestones, or these milestones of myelination on MRI, we can see the tendencies or the patterns described by Barkovich recurring. We see that the myelination goes from back to front with the splenium, myelinating before the gene of the corpus callosum, and the occipital white matter myelinating before the frontal white matter. Also notice that T2 lags behind. The same pattern seen on T1 weighted images in a 7-month-old child is only seen in T2 weighted images in a 14-month-old child. So look up this article, even if it's just for these very nice drawings. When is myelination complete? Well, because T2 weighted images lag behind on T1 weighted images, myelination will appear to be complete sooner on T1 weighted images compared to T2 weighted images. On T1 weighted images, myelination looks as if it's complete or as good as complete in a child of about 1 year old, but in a child of 1 year old, it still doesn't look completely myelinated on T2. Compare, for instance, it might be subtle, but compare, for instance, the signal of the subcortical occipital white matter with the subcortical and deep white matter in the frontal lobes. There is still a clear difference that is, to a lesser extent, present on T1 weighted images. Let's now compare these images with a child of 2 years old. Here we see that the myelination is complete on T1 weighted images, but that's a bit comparable to the pattern we saw in a 1-year-old child. However, if we compare the deep and subcortical white matter of the occipital lobes of a child of 2 years old with the white matter in the frontal lobes, we see that there is no difference anymore, and myelination looks complete. The only structure that can still appear to be slightly unmyelinated in a child between 1 and 2 years old is the subcortical white matter of the anterior lobes. We see that here very clearly on a T1 weighted inversion recovery image. There is no myelination yet of the subcortical white matter in the temporal poles compared to the subcortical white matter here of the frontal lobes. And this concludes my overview of normal myelination in the neonatal brain. I'm going to do some other videos on pathology of the neonatal brain. I find this a very important topic because in order to detect pathology in the neonatal brain, you have to be familiar with what a normal neonatal brain looks like. And I hope I succeeded with this video. If you have any feedback, please leave a message, leave a comment in the YouTube comment section, or you can also send me a mail to neuroradiology.online@gmail.com. I hope you find this interesting, and I hope to see you again for another video on neuroradiology. Thank you very much.